today we are going to launch visually about 20,600 oxygen cylinders. We have not filled them with oxygen because that depends on consumption. Yes, depends on consumption, but we have 150 here that are already filled with oxygen. These cylinders, Your Excellency, are marked Government of Kenya, Ministry of Health. Because, as Lyndon will say, the Global Fund is not a donor. It's actually a partner of government because there's a multilateral mechanism whose money is owned by government, including the government of Kenya. And we are really grateful that they responded to the COVID-19 challenge of access to oxygen. We went through the government and Ministry of Health to the counties to assess the challenges of oxygen access, which were highlighted, as you said earlier, by the demand through COVID-19. And out of that, the mapping was done, and it was a dire situation. Many of the challenges we found, Your Excellency, were that oxygen was not available, that even where we had the production plants for oxygen, many of them were not properly maintained. But one of the critical challenges was oxygen cylinders. Oxygen cylinders became a problem because they were not available. At some point, we thought we had about 20,000, but they were disappearing in people's homes because of the demand and the need for people. We then found that actually, and the governors are here, and I'm really happy they're here, that for every hospital or governor to access oxygen, you have to put a deposit for an oxygen cylinder, so that you can access that oxygen cylinder to be filled for oxygen for your patients. This, deposit was significant. In some areas, it was 4,000 shillings. In some areas, it was 17,000 shillings. And this project we are launching today, Excellency, removes the need and the demand for deposits from the governors to access oxygen. That is significant because now the oxygen can be accessed as and when needed. And that is why, with the support of the Global Fund for HIV, TB, malaria, we are launching today, and they are available in this country, 20,620 medical oxygen cylinders worth 1 billion shillings from the Global Fund. But these cylinders are just a visual representation of your honored launch of this project today, Your Excellency. This project is part of a 5 billion Kenya shilling project for $1 million through the support of the Global Fund special mechanism. The Global Fund supports HIV, TB, malaria, but we have been working with the Global Fund to ensure that the Global Fund also supports health system strengthening for countries not only to be dependent on the Global Fund, but also to build the health systems for primary health care and for universal health coverage. And during COVID-19, the Global Fund responded and said they're indeed going to repurpose some of the funds to support the oxygen infrastructure. So as part of these 5 billion, 1 billion is going to cylinders, but the rest of it is going to the construction of 22 oxygen production plants across the country, Your Excellency, supply and installation of 14 oxygen bulk tanks. These are bulk tanks that allow level 4, level 5 hospitals to have oxygen just right there, which is piped into the hospital, that they don't have to rely on cylinders. But beyond that, we've had a challenge. We found out that cylinders in this country and in many countries in Africa are used one cylinder, one patient, which means that whereas one cylinder can serve multiple patients, you have cylinders dedicated to a bed. This problem is being solved in this project, Your Excellency, by doing what we call manifolds to ensure multiple cylinders can be attached together and supply the oxygen to a hospital through a piping system, which means now that you can actually optimize the existing cylinders. That's also part of this project.